So then, Karen, what initially brought you to the clinic? What was the problem?
Pain in my right shoulder, really sharp shooting pain that pulsated.
Really? And how long had that been going on for?
About 3 weeks on and off. And it used to come and go, but when it came on, it was like, it was terrible. It was like a contraction, which built up, and then it felt like somebody was stabbing you in the shoulder blade.
Really? And had you tried any other methods before?
Yeah, I went to the GP, I tried some stretching, and then he gave me some really strong painkillers, anti-inflammatories, but they worked for the duration while I took them.
Yes.
And then as soon as I stopped taking them, the pain started creeping back.
Did you see, were you also referred elsewhere to, was it physio you were seeing?
I was supposed to be going to physio, but I've done physio on my lower back before, but that didn't really, do much, because they can only target the area where the pain is. They don't actually look at the root cause of the problem.
And so what was it in particular you were looking for that was different?
I didn't want to just target the area. I wanted to actually find out what caused it and get back to the root cause and fix the root cause.
So then when you came to our practice, was there any doubts, anything you were unsure about before you came?
Well, no, because it was recommended by a friend who said, he always felt like he was 12 foot tall after he'd been to see his chiropractor. And, he's quite an old back like me.
Sure. And so what was the main thing initially that you noticed the difference?
The pain, because it had started creeping back in, and that went more or less immediately over the first couple of days. Wow. And then a lot more movement in my back and my neck.
Sure. And it's been how long now into your
4
care?
days.
4 days. And what sort of percentage improvement would you say?
There's a good 90% improvement in my neck and my back, compared to where it was when we started.
Excellent. You see that's positive so far? Yeah.
Definitely positive, definitely. I'd like to come every single day.
You're going on holiday now?
I'm going on holiday,
yeah, well, at least you can enjoy your holiday now. Huh? And tell me in terms of the sleep, you used to mention you used to have sleep problems, right?
Yes, I don't sleep very well, haven't done for years, but last night after the session, I slept for me extremely well,
Wow.
which was kind of unheard of.
Well, added bonus.
So I'm hoping that continues.
So far, so good, huh?
Yeah,
excellent.
definitely.
Okay, thank you very much. So, Mrs. Karen Hennessy, can you just share with us your experience and how we've gone from sort of a crisis pain management and what you feel the benefit is now to you?
Well, I feel now we've got past the issue with the pain, and now I can feel that my spine is straightening up. I'm straightening up, and then there's a lot more movement in my in my upper body, my shoulders, my neck. I feel more flexible in lots of ways, so that getting up and down and moving around, I don't feel like an old woman anymore. I actually feel a few years younger.
Sure, excellent. How have you found the implementation of the home care and the support? How do you feel that the two work together?
I think they complement each other very well, and I think you only get out of this what you put in. So it's no good just turning up for the sessions and then hoping that's it. You've actually got to do the home care, concentrate on it, and put a lot of effort into it, because the in-between sessions that you do yourself are as important as the sessions in here to keep the momentum of what's going on within your body.
And Ms. Hennessy, can you please tell me about why you feel the benefit? I mean, yes, that initial pain has gone. So what do you feel the benefit is for you now?
Well, now, like I say, I do feel a lot looser, more flexible. I don't feel so stiff all the time. And I feel like I can get up and dance now rather than before just shuffle around the floor.
Sure. And you talked about you said that this was something you were looking to go into full correction. I mean, in what way do you see this thing going? What is ultimately are you looking to achieve, and where do you because we've gone past pain. What are you looking to?
Well, my goal is all the pressure I put on my back and my spine through back posture and various things over the years. I want to, fix it and then start maintaining it. So when I'm 60, I'm still sitting up straight. When I'm 70, I'm still sitting up straight. It isn't a quick fix. It's, you know, get it in, go through whatever I need to go through now to get it back to as best I can to where I can get it to, and then keep maintaining that in the long term.
Sure. And considering the disc problem that is evident in the lower back, the bulging disc, and your experience so far, do you see yourself going in the right direction? Do you think things are moving?
Definitely. I can feel the benefit already with, you know, just the fact I can actually sit up straight. Previously, to sit up like this would be painful and extremely uncomfortable. But now, you know, through the corrections and through the exercises, I can sit here quite comfortably for quite a long period of time, sitting properly, whereas before I couldn't do that.
And how has this had an effect on like confidence levels and so?
Oh yeah, you just the fact you stand up straight means you feel a lot more confident. My husband actually commented I've grown about 2 inches because he's only little anyway. But when I now stand up straight, I mean, maybe it was one of the reasons I did stoop a bit because he's a bit short. But you don't realise over time that actually, you know, and when the way people view you when you stand up straighter is completely different to when you slouch.
Sure. So there's confidence in terms of outlook. What about in terms of confidence related to the back and, you know, those past worries that you have regarding the spine, the protective mechanisms? What about?
When we first started, I was very protective of my lower back because I have had previous issues with it. But now that feels stronger. So, as you know, as part of the whole spinal therapy, it seems to be, you know, going with the programme. And, you know, so touch wood, I haven't had any issues with my lower back.
Excellent. So far, so good, huh?
So far, so good.
Excellent. Doing well. Thank you very much. I appreciate that, Karen.